All right, hello. So we're going to do a postural assessment today. We're going to just look at sitting and standing posture, as well as just talk about some posture during different movements. So first, we just want to assess the patient's sitting balance. So right now their hands are like in their lap, but kind of like not on the table. So it appears that they have good sitting balance and probably good core stability. Just checking out their upper trunk, it looks like their shoulders are symmetrical, so there's no deviations in that. And then they're able to, so because they don't have their hands on the table, it means that they're probably displaying good stability and balance in that regard. So after this, we would move to the side of them, getting a lateral view of the patient. We want to use our plumb line, and so using that to view through all the different joints up to their ear, so to speak, on their shoulder, hips, knee, and ankle if they were standing. And so just viewing this, it doesn't appear that the patient has any abnormal forward head posture. Their shoulders are at a good height. There's no abnormal tilting in their pelvis. So this patient is displaying good signs of posture. Next, we'll move from behind and again assess some other features of their posture. Again, their shoulders appear to be at a good height. We can also assess their pelvis. We can just look to see how well the pelvis is moving. So I'll have you just bend forward a little bit for me. Okay, can you lean back a little bit for me too? Okay, good. Can you go side to side for me just a little bit? Okay, side to side. Yep. And so we can also just make sure they're shifting their weight well. We kind of already did this, but this time I'll just kind of slide my hands under your bottom. Okay, can you shift again for me? To the other side. All right. So yeah, the patient's able to display different, just positive aspects of their posture, good weight shift, no abnormal pelvis deviations. Also, we would just make sure that their pelvis doesn't have any obliquities, which would be defined as an obliquity being if like one side of the pelvis is higher, then the lower side would be the side of the obliquity, meaning if the right side of his pelvis was higher, the left side would be the obliquity. Our patient doesn't appear to have any of those, which are good signs. Last, or not last, but we're going to have the patient stand up. And so again, we'll come out to the front. We'll just assess the patient's posture. Again, good shoulder height. The patient doesn't appear to be leaning on one side too heavily. I'll also ask you to weight shift for me a little bit. Just lean your weight. So the patient displays good stability and balance, being able to weight shift. We'll come out to the side and use our plumb line again. Again, the patient's head and neck aren't too far forward. Their shoulders are in line at a good height. Their knee and ankles. The knees are a little bit forward, but that's perfectly fine. There's no abnormal deviations and there's no curvature in the spine. And so, yep. And so at this point, we would want to assess posture during like a functional movement, for instance. So we could probably assess the patient's posture as they're going up the stairs, making sure that they're able to use the rail or they're able to maintain their balance, their pelvis isn't deviating in any way. Maybe even looking at their posture as they go into the shower and making sure there are any deviations in that. And so thank you.